Welcome and thank you for joining us for the 7th episode, Assessing Your Community Needs, Assets, and Resources, Part 2. Hi, I'm Beth Malchus-Stafa, and today I'll be presenting with Debra Seltzer and Dr. Sandra Ortega.
As we talked about in our last episode, a Community Needs, Assets, and Resources Assessment, or NARA, is an important part of planning and evaluating your program. Simply speaking, a NARA is a systematic way to show the gaps between the community's current condition and the community's desired condition.
We also discussed using a strengths-based approach in comparison to a deficit-based approach. Identifying a community's assets allows residents to gain control over the conditions identified.
This approach involves not only your primary, secondary, and key stakeholders, but the community at large.
The learning objectives for this episode are, first, interpret what your data is saying. This involves making sense of the numbers, questionnaires, surveys, and maps you've collected about your community.
The second objective is identifying criteria for prioritization, meaning what in the data is most important to your stakeholders and why it is important.
The third objective is sharing this information with stakeholders and your community.
Our last episode, we talked about the purpose of the NARA. The NARA is a process for gathering information about the current conditions of a community, both the assets or protective factors and the deficits or risk factors. When you do this, it helps create a picture of the people, the environment, and the relationships between the people, environment, and the conditions within the community that are either support or hinder the outcome of creating safe, supportive, and nurturing environments.
I think I said this the last time. A NARA is that bird's eye view of the multiple systems that make up the ecology of your community.
And what we're addressing in this episode, the findings of your NARA will help your community set realistic PPPs and the most desired community outcomes.
Sandra, I like that you're emphasizing community. It's a good reminder. This is a community NARA, not an RPE NARA. Our stakeholders need to be part of every step along the way. This episode, we'll be focusing on steps 6 through 9. If I had to choose between steps, sharing with community would be for me, which is step number 9. Step 6, organizing, analyzing the findings are not my cup of tea.
Bring on the teapot, Beth. Maybe it was how you were taught and how to understand data. Everyone has qualities to understand the data: effort, patience, discipline, and dedication. I know you have that, Beth. Plus, I know you like a good novel.
You're right about that. I like a good mystery novel.
Think about the data as clues to your mystery.
In the last episode handout, the exercise asked you to gather your data and organize it. As before, you and your stakeholders may have found gaps in the data sources supporting your community's PPP strategy choice. That's okay. Or maybe you discovered that the data were 10 years old. Not to worry, you have time to gather more data.
The CQI process is a continuous process that spirals. For example, if you're missing clues to support who stole the book in the library or where the geode is hidden, you always have time to gather more evidence.
Funny, Beth. I can really appreciate the Seinfeld reference, and your metaphor is right on. Your NARA data should tell a story. In our case, it should be a community story about sexual and gender-based violence prevention. But all the data sources should not be included in the story. You and your stakeholders need to sort your data.
Oh, if we would just have the sorting hat. I couldn't resist.
A Harry Potter sorting hat in place of you and your stakeholders' minds working together? I'll stick with the group rather than a hat to decide the fate of my community. Remember, back to our last episode, when you and your stakeholders formulated a question around the current state and the desired state, the data you collected will help you draw accurate conclusions. The slide shows common strategies, questions, or factors for sorting your data keeping in mind your formulated question. It's good for you and your stakeholders to review the data together. 10 or more eyes are better than 2. Someone may know more about a data set than another person. For example, someone may know firsthand that people from the community will not act on, say, painting a mural, but will act on a community movie night at the library.
You're right, Sandra. I can see having more people to look at the data. You could also see where, say, risk factors are trending, and maybe another data source would identify the root cause.
You could then sort to discover what assets and protective factors could be mobilized in the community to narrow the gap of the root cause.
I think we can agree a sorting hat would not do that. Another tool I recently came across is on veto violence. In their Connecting the Dots module, there is a connection selector. The tool allows you to connect risk and protective factors across different forms of violence, such as sexual violence, bullying, and suicide.
I could see this tool being used to invite more community partners to the table. For example, if it was discovered our community had a strong risk factor, such as poor neighborhood support and cohesion, those new partners could help narrow the gap, especially if they are working on the same risk factor.
I can see this type of sorting as saving resources and having a public health impact. By mobilizing around one risk or protective factor, we can address, in this case, 5 types of violence.
At the state level, we're starting to do this. One project that comes to my mind is the Safe States Aspire project. The goal of this project is preventing adverse childhood experiences, or ACEs. Aspire pooled together state agencies that are trying to prevent or increase resiliency to reduce ACEs. The state agencies were asked to identify the risk and protective factors they are working on for each of their federal grants. The Aspire team did a connecting the dots connection selector, so to speak. The sorting process identified the same risk and protective factors we're all working on together in Ohio, and those we're working on individually. There have been some surprises, meaning we found out that we are working on the same risk and protective factors, in the most part, in a silo.
I'm sure that happens a lot, Beth. I mean, not knowing what other folks are working on because you have not had the opportunity to be in a room together to know the other teams are indeed working on the same risk and protective factors. And what was the outcome of you all coming together, Beth, through Aspire?
The outcome of stage 1 for the Aspire project is we all agree that we continue to work on our continued risk and protective factors. And we have agreed to work together on 1 protective factor and 2 risk factors. By doing so, together as state agencies in Ohio, will, by the theory of change, have a greater public health impact.
The Aspire project is exciting. If we pull together resources to create a social marketing campaign around the protective factor, connection to a caring adult, and what it means to be a caring adult, it makes my mind spin about the possibilities if everyone is saying the same thing.
Sandra, the sorting of data seems easier by using the Connecting the Dots tool and pre-identified factors to sort. But things get hairy for me when my data gives conflicting viewpoints. Sometimes the data tells opposite stories. For example, the school says 98% of the youth feel connected to their school, but the student survey says 10%. And the PTO focus group says only 1%. What data do you believe? Sometimes data makes me scream and freak out, like I've seen a hairy spider.
I agree with Beth. When analyzing the data resources, you get different results. Who do you believe? Do you throw out the data?
That's a really good question. I think it takes a lot of teamwork to make sense of data. When I get divergent data, I think about what might be creating that difference. I always like to start out with the question, did anything about the data jump out at you? In this case, Beth, what jumped out at you is what seems to be some contradictions in the results between the three respondent groups. So it might be that the teacher's questionnaire asked the question differently than the other two respondent groups, since the results are similar for the students and the PTO members, right?
Mhm.
I think
Yeah.
it's really important to have a discussion with the various stakeholders about what those divergent data may mean, and maybe going back to the original data collection instruments to take a closer look at the various items and also the scaling of those items. Is the scale reversed for the teachers and the analysts didn't know the scale was reversed? There are so many things that happen on the way to the analysis and interpretation of data. Without reviewing and having a discussion, we may misinterpret and then make decisions based on erroneous data, right?
Right.
I know that several RPE programs have been using a Venn diagram to help sort through and analyze their data. It's a basic graphic organizer to help compare and contrast two or more items. It can also help interpret what the data is saying. I've used a Venn diagram to discuss the similarities and differences between the ODVN Delta data dashboard and the environmental scan.
I know that this diagram is popular with many teachers to help students think critically before writing their papers. I can see how you can begin placing data sets into categories and find out how they overlap.
Yes, Beth, that's right. One group I worked with used the Venn diagram in a community setting. Youth, adults, and other stakeholders participated in helping create a social marketing campaign. The facilitator asked, what do you think is important in a social marketing campaign to reach your peers, to both the adults and youth? The overlapping places, which in this slide would be yellow in the circles, which held the adults' responses, or say the blue side, and the youth responses on the pink side, helped the community see where they needed to look closer. So in this diagram, what overlaps is that information that's in the yellow. They began to see some themes about how to best develop a social media campaign and use the convergence in the data to develop that campaign.
Sandra, I can see how the Venn diagram could help sort data and identify common themes.
I think sorting might show some surprising results, maybe even contradict preconceived notions. I think this would be a good time for you and your stakeholders to reflect on why these are surprising and not be quick to judge. You might discover that you need to work on one risk factor before you can even address a protective factor.
And based on our hairy and fuzzy data exercises, this is the time to reflect on who is telling the story. For example, is the response from youth or another population talking about youth? How are these different data results interconnected? Reflecting and talking through the results help you and your stakeholders draw conclusions.
My daughter is a writer, and she talks about the first draft of novels. That is a hard and sometimes messy process. She reassures me that it's okay. It's part of the process.
I've been told that you should be wary of judging your work too soon. Our previous slides, we talked about sorting and interpreting to reveal a story about what is happening in your community. I think we should realize that the first draft of your NARA might be broad enough to include everything, and a request for a kitchen sink.
Yes, it might show that a kitchen sink is needed, but is the kitchen sink really needed? And does this need for a kitchen sink really answer you and your stakeholders' question? For me, I see the first draft of the NARA as a sneak peek as to what is going on in your community. It's showing the big picture. It will also help you make better decisions supporting your PPP choice.
From a realistic standpoint, you can't address all the risk factors or deficits and protective factors or assets identified.
Or all the other things that you find in your first draft or run through your data. You and your stakeholders will need to narrow down how you will answer your question. As we spoke previously, the first draft of your NARA allows you and your stakeholders time to reflect on the data.
Now comes the harder work. What will you and your stakeholders work on first? And are there any community assets that can help work on the issues identified? You need to decide together what priorities you can work on. Setting priorities together is important, especially when you may have competing resources and/or limited resources available in a community.
We've spoken in several CQI episodes that it is important to use participatory decision-making. I want to emphasize that the RPE preventionist isn't the owner of the NARA, the community is. Narrowing down your priorities together keeps decision ownership within the whole group.
It also allows for more voices to be heard. Participatory decision-making has also been found to allow the participants to think deeper about the problem and the potential solutions.
There are good tools and techniques out there that can help you and your stakeholders facilitate this type of decision-making. Voting by dots or the TOPS facilitated discussion are two examples that can be used to determine the priorities of the community.
For example, if you are voting by dots, you could write out the results from the NARA on poster board or even use an online tool and allow people 3 dots to vote. The item can then be ranked by the number of dots or votes each item received.
Using the technology of participation facilitated discussion gets people talking. The participants can tell each other why they are placing ideas in higher priority than another.
You bring up a good point, Deborah. You and your stakeholders need to have some agreed upon idea as to why one issue or asset should be a higher ranking than another. Feasibility is another consideration to help you and your stakeholders begin to narrow down the priorities. An item might be high in the ranking in your dot voting, but if you consider the community's assets to make it happen, the priority might not be as feasible in the near future, right? In other words, you need to have feasibility criteria that can be used to determine how best to use your available time, energy, and resources in working on your PPPs.
I can see your point, Sandra, and if the community identifies green space as a priority, like building a park to increase community connectedness, is this realistic? Finding space for a park is only one factor. The cost of building and maintaining a park is another. Whereas increasing community connectedness by increasing volunteer opportunities for, say, creating a mural or cleaning up on Earth Day may be more feasible for a community. At this point, you and your stakeholders will need to create a written report of your results. This report will be the foundation for selecting the PPP and creating an action plan or logic model. As part of this report, you should talk about the NARA process and what was discovered during the process.
You should talk about the sorting process and what your criteria were for prioritizing one area of need over another, or one risk factor over another risk factor.
At this point, the NARA story or report will begin to identify potential PPPs. Remember, we talked about PPPs and choosing PPPs in a previous CQI episode. And don't worry, if you're not an expert in writing a logic model, there will be an upcoming episode on how to create one.
Your NARA report will also help you identify ways to measure your future success. How will you know if you are successful in achieving the outcomes? Who can help you with monitoring and measuring your results? This too will be important information in your logic model. Remember, evaluation closes the loop in the CQI model.
The most important part of this report is to share it with your community. In doing so, you'll create ownership, support, and engagement in the future PPP activities. You are also creating an environment that helps people adopt and sustain behavior if they are active contributors.
But you need to know your audience. A written report with lots of writing and bars and graphics might not be accessible to the youth you want to engage with. Similarly, public officials may just want a one-page or with talking points or headlines, whereas the local Rotary Club might prefer a PowerPoint presentation that helps them see their role in helping achieve the outcomes.
Yes, I'm always surprised at the reporting requests I get based on who is doing the asking. I've become accustomed to creating different types of reporting templates depending on who I want to communicate with, so I can move them to action. And also knowing who is moved by what data or results, right? The other thing I have learned over the years is how to use different techniques such as bolding and placement of words and phrases, because readers tend to be drawn to certain parts of the reports. I've learned to put my most important points at the beginning and end of the reports, because that is where busy readers who skim documents tend to be most attentive. We have been talking about how the NARA is a story. Your data is there to help support your story. Good visualization can really help your audience know the story.
Many of our programs are using infographics to help tell the story. I've seen pieces of infographics reposted on Facebook and Instagram.
I've been in several programs that have been using live graphic illustrators. The results are really engaging.
That sounds really cool, Deborah. I also want to alert people to Stephanie Evergreen's work. Stephanie has created a card deck to help you choose the format for your charts and graphs. Dr. Evergreen also has a really cool blog and website to help folks create data that is much more consumable than the academic conventions we all learned in university and/or high school.
I think the bottom line is know your audience and the way they like to receive their information. For example, I know my parents who are in their 80s like to watch a good news story, whereas my son and his friends like a good TikTok.
I would love to see a TikTok story about a community issue. I know I get a lot of my information these days on various types of social media.
Knowing your audience will also tell you what kind of content you should present.
I feel like we've covered a lot in this episode. One key point is taking the time to really figure out what the data is saying about your community. Looking at the data is a participatory task, not a solo task for the RPE preventionist.
I agree with you, Beth. You really need to understand what is in the data and why it is most important to you and your stakeholders. Another part of sorting your data is identifying your criteria for prioritization. The reality is you and your community can't do everything. What can you do in a year? What can you do in 5 years? And what can you accomplish in 10 years? And what resources do you have to accomplish these activities?
This is where your community assets and resources come into play and what is really feasible in your community. This is important information when selecting your PPP. For example, your data shows that you need to build community connectiveness and you don't have the resources to, say, build a community center. What other PPPs can you select to support your data? Maybe an example would be having a community 5K that brings people out to support your organization and lifts up safe and supportive and nurturing communities where everyone can thrive.
Finally, you need to share the NARA story with your stakeholders and the community. You need to build community ownership of this report and ultimately the plan. You need to consider each audience you are sharing the report with. The messages you share with a youth leadership team may be different from how you share it with City Council.
During today's episode, we've mentioned several resources that I think are helpful for getting started on your CQI plan. We want to alert you to the Empowerment Evaluation Toolkit. The NARA is part of this toolkit, housed on the Ohio Domestic Violence Network website.
Thank you for joining us today for episode 7, the continuation of your needs, assets, and resources assessment. Remember, we are here to support you, so just reach out to any of us if you want individual TA or just want to bounce an idea off of us.
We also want to thank Jasmine Barfield for her techie and vlogger expertise. The results of working with her has advanced our work forward by using a different learning platform. We are very grateful. Finally, a program about CQI would not be complete if I didn't ask you to fill out the evaluation following this episode. Your input helps us with future episodes and identifies if we need additional resources. Stay tuned for our next episode. We will be discussing logic models.